Hi, my name is Lindsay Bear, and I'm going to speak to you all a little bit today about hearing impairments in children. So the Individuals with Disabilities Education Improvement Act, abbreviated as IDEA, includes hearing impairment and deafness as two of the categories under which children with disabilities may be eligible for special services. The term hearing impairment is often used generically to describe a wide range of hearing losses, including deafness. Hearing impairment is defined by IDEA as an impairment in hearing, whether permanent or fluctuating, that adversely affects a child's educational performance. Deafness is defined as a hearing impairment that is so severe that the child is impaired in processing linguistic information through hearing, with or without amplification. The U.S. Department of Education reports that roughly 1.2% of all students receiving special services in the U.S. are classified as having a hearing impairment. There are four major types of hearing loss that are a disorder in the auditory system. These hearing disorders can be caused by genetic or hereditary factors, infections, developmental abnormalities, or environmental factors. Conductive hearing loss is caused by damage or obstruction in the external or middle ear that disrupts the effective passage of sound through those chambers. Sensory neural hearing loss is caused by damage to the inner ear known as the cochlea, or auditory nerve that transmits impulses to the brain. This type of hearing loss tends to be more severe and permanent. Mixed hearing loss is a combination of both sensory neural and conductive hearing loss. And central hearing disorders are the result of a disorder or dysfunction in the central auditory system between the brainstem and the auditory cortex of the brain. It's useful to know that sound is measured by its loudness or intensity in units called decibels. Generally, only children who cannot hear sounds generating less than 90 decibels are considered deaf for the purposes of educational placement. Variations in causes, onset degree, and types of hearing loss, as well as family and educational situations, result in widely diverse hearing impaired population. However, students with auditory impairments characteristically experience significant issues with regard to social and intellectual development, speech and language, and educational achievement. Since social emotional development relies so heavily on communication, the student with hearing impairment may not participate in cooperative play or learning activities. Without a common communication system, the ability to develop friendships is negatively impacted. Research has determined that individuals with hearing impairments have normal cognitive ability in the absence of any coexisting disability. And speech and language is, of course, the skills and the development that suffers most greatly in students with hearing impairment. For individuals with mild or moderate hearing loss, the effect may be minimal, especially with early diagnosis and treatment. Most children who are deaf are enrolled in school on a full-day basis and practice special work on communication and language development by the age of 5. Since the great majority of deaf children, over 90%, are born to hearing parents, programs should provide instruction for parents on implications of deafness within the family. There are many assistive technologies that provide supports for students with hearing impairments. These include hearing aids, computers, alerting devices, captioning devices, and texting. One very effective assistive technology I'd like to speak a little bit about is cochlear implants. These are sometimes called a bionic ear, and the cochlear implant is a surgically implanted device designed to make sounds audible for some children with hearing loss. The cochlea is the snail-shaped part of the ear that contains all the nerves used for transmitting sound. The cochlear implant bypasses the damaged part of the cochlea and uses its own electrical signals to stimulate the auditory nerve, allowing the child to hear. It is amazing technology. All right, so hopefully that provided you with a better understanding of what hearing impairments are like in children and the effects this disability can have on the student's education.